Federal Drive is presented by GEHA, Government Employees Health Association, proudly providing health and dental benefits to federal employees and their families. Visit GEHA.com.
The latest Health IT Standards update provides a blueprint for better data transferability across care settings. From care plans to device tracking, the focus is on making health information more useful and more responsive to real-world needs. Here to explain how the update supports smarter, more seamless data exchange and why that matters for patients, providers, and public health is Senior Health IT Specialist in the Office of the Assistant Secretary for Technology Policy at the Department of Health and Human Services, Sarah Armson. Ms. Armson, thank you so much for joining me.
Thank you for having me, Terry.
Let's start with the basics. The new United States Core Data for Interoperability version 6 is on the street. What is that? Let's start there.
It is. So for short, we say USCDI, and this is the standardized set of health data elements for national interoperable health information exchange. We often say that USCDI is the minimum data set for the healthcare delivery system. And USCDI version 6 was just published in July of this year. So STP-ONC publishes new versions of USCDI annually. We publish a draft version in January and a final version every July. And this annual publication cycle helps us keep USCDI up to pace with clinical and technology and policy changes.
Are there specific gaps or changes that this update is meant to address?
So USCDI addresses a need for a baseline for exchange across care settings and use cases. This is a standard set to drive interoperability, and it sets the technical foundation. It sets the technical foundation for exchange of electronic health information to support patient care and patient access to their health data. This new version, USCDI version 6, includes 6 new data elements, and those are unique device identifier, portable medical orders, facility address, care plan, date of onset, and family health history.
Why add those 6? What are you trying to gather by getting those data elements now in the new version?
So for each new version of USCDI, ASTP is collecting public feedback to determine what should be in that baseline set. And we actually have 2 public feedback periods per version, one prior to publishing the draft and one prior to the publication of each final version of USCDI. And during this feedback period, we are inviting and encouraging proposals for new data elements and also feedback on the existing data elements that are already in USCDI to inform revisions. So during these feedback periods that led up to USCDI version 6, we received feedback from over 70 organizations and individuals to inform this new version. We're also guided by some key priorities for each version of USCDI. One important one is implementation burden. The implementation burden for standards development organizations, for the developers of health IT products, and for healthcare organizations who will integrate these changes into their clinical and other types of workflows. We're also looking at other factors that might impact implementation burden, like other new regulatory requirements that are going into effect at the same time. In general, we're prioritizing additions to USCDI that are broadly benefiting health IT users and also improving health outcomes.
I'm speaking with Sarah Armson. She's a senior health IT specialist in the Office of the Assistant Secretary for Technology Policy in the Department of Health and Human Services. Sarah, you mentioned implementation burden in that last conversation. What does implementation look like kind of in practice? And I want to put that in context of something else you mentioned, which is different care settings, right? So we can imagine a doctor's office, a hospital, but we might also imagine assisted living or other kinds of care sites. So talk to me about what implementation looks like in all of those different kinds of settings.
So across all of these sites, there is health IT that is supporting the delivery of care and also the interoperability of the data that informs that care. And ASTP ONC stewards the ONC Health IT Certification Program. This is a certification program that supports care delivered by more than 96% of hospitals and 78% of office-based physicians across the country. So a large swath of the health IT used across the country is looking at this USCDI set of data elements to inform what data it needs to be able to exchange in order to participate in this certification program.
I imagine most of us can envision ourselves in a doctor's office being handed a clipboard of forms that we have to fill in, but really can't think about what happens on the back end of all this health IT and all of this data as you've just discussed. I assume that it is necessary to inform not only the work of HHS, but the healthcare insurance industry as well.
So you can think of the USCDI data elements as not necessarily informing what your provider that you're sitting across from with the clipboard is gathering, but actually what data elements the health IT systems that your provider is using, what data elements those systems need to be able to send or receive to other systems. So that could be health insurance, but it could also be moving patient data from provider to provider, or possibly moving health data information in large amounts to inform things like research of health data or public health.
You mentioned that over 70 organizations provided feedback on this initial draft. Have you gotten any pushback to the amount of data that's required to be included in the health IT systems?
It is always a balance to figure out how many data elements belong in a baseline, in a minimum data set. And certainly we get different flavors of input when we're asking this in our public feedback periods. And that's why we have 2 feedback periods per final version of USCDI. When we're in a public feedback period before the draft, we're looking for what should go in that draft. And then when we're in the public feedback period after the draft, we're looking for feedback on, did we get that right? And should we make adjustments?
Now that the draft is out for this year, what should health IT developers and providers and policymakers be doing to prepare for adoption?
The final version of USCDI version 6 opens up the feedback period for informing USCDI version 7. So one thing that you can do looking for the future is engage and collaborate on the next version of USCDI. We have a submission system for recommending new data elements. That's called the ONC New Data Element and Class on Deck for short. And we also encourage comments on existing data element pages. And all of this you can find on healthit.gov/USCDI. This feedback period closes on Monday, September 29th. So plenty of time coming up here.
I've been speaking with Sarah Armson. She's a senior health IT specialist in the Office of the Assistant Secretary for Technology Policy at the Department of Health and Human Services. Sarah, thanks for this little glimpse behind the curtain of health IT.
So glad to be here.
We'll post this interview at federalnewsnetwork.com/Federal Drive. Subscribe to the Federal Drive wherever you get your podcasts.
What makes a great leader in government? Christine Harada joins WEPA CEO Shane Canfield to reflect on her journey from aerospace engineering to the White House. In this episode, she shares lessons on public-private collaboration, leading with purpose, and why service, not power, should guide leadership.
Hello, and welcome to the Lessons in Leadership podcast. I'm your host, Shane Canfield, CEO of WEPA. Today, I'm joined by Christine Harada, former Senior Advisor at the Office of Federal Procurement Policy within the Office of Management and Budget. Ms. Harada, welcome, and thank you for joining me.
Thank you so much for having me.
You spent portions of your career working in both the public and the private sector. And from your experience, what makes leadership in the federal sector different than the private sector?
At the highest level, leadership in the public sector is very fundamentally at its core mission-driven. Right? The work is in the service of the public good, and the goals and the programs are frequently long-term, they're systemic, and they're incredibly complex. And success, isn't necessarily measured by quarterly earnings. We don't have that kind of drumbeat, but certainly more by the lasting impact that we have on Americans' lives. What's also unique about public sector is, in my view, the profound sense of history that you feel. And I think certainly I was very aware about the work that I was doing and how it builds on the efforts of those who came before me, and that future generations of leaders also depend on the decisions that were being made today. And that, for me, certainly provided a greater weight of responsibility.
That's a wonderful answer. And I was in the private sector for much of my career, and now WEPA is a nonprofit, and I really relate to what you said about being mission-driven rather than profit-driven. You've got a long-term view, and always at the core of it is serving others.
Yes.
Is there a moment that stands out to you from early in your career that influenced your leadership style later on?
I started out my career as an aerospace engineer, building satellites in airplanes. And when I first entered the workforce, my organization at the time had 120 people. We were a large company, 120 people, 4 women, and I was the only woman of color. I was also the youngest throughout the entire organization. And so, I remember having an experience when I was doing some engineering work. We had a design review, and I had seen some issues with the flight software that I pointed out. At the time, they're like, maybe it's not really that big of a concern. I was like, but in my heart, I knew that the issue was real and stayed with it. And sure enough, a few weeks later, that topic came up again, and we addressed it. Turns out my concern did indeed prove to be valid. And so it's just one of those experiences that really sank into me around ensuring that I am listening to everybody, period, end of story, within the organization. Really thinking through about how do we take into consideration opinions from all different spectra. As a third-generation Japanese American, right, I was raised to be humble, keep your head down, and work hard, etc. But at times, leadership also requires you to speak up, do so politely, with courage, etc. Even though you may be the only voice in your room, but certainly trust your voice. It also really helped shape my belief around diversity. DEI programs right now are viewed in a negative light. We're all mosaics, and they become better because you have those different experiences. And that's really stayed with me throughout the entirety of my career.
The diversity issue is a really big one coming from the insurance industry. That's an industry which is working on that. It's really a diversity of viewpoint and perspective and experiences that does influence your business. And more diverse employee bases absolutely helps. Was there a time in your federal career, perhaps when you were at OMB, that you faced what you consider a real challenge? And how did you overcome it?
One moment that really stands out in particular was when I was serving as the Federal Chief Sustainability Officer during the Obama administration. We had set, like many administrations, had set some really ambitious goals, very, very, very ambitious goals around How do we think about making the federal government's operations much more sustainable? But the challenge wasn't so much about the scale or the technical capacity of the organization. A lot of it was really centered around the funding. We overcame this largely by being very strategic, helping out with blocking and tackling with the variety of legal issues or legal questions that might have come up, like how do we address this? Certainly in the federal government, you're more often leading through influence as opposed to pure form authority, and that you really need to listen deeply, communicate clearly with folks, building out those coalitions and engaging with your stakeholders. And I know many folks in government speak like that, but that is the truth.
As someone who's spent time in both the federal and the private sectors, what makes the relationship between the two sectors important?
Certainly, it's an absolutely essential partnership, and I would add on to that like nonprofits or philanthropic organizations. As I mentioned before, I'm Japanese American, and in Japan there's a symbol for thunder, which looks like 3 arrows pointing around each other in a circular pattern, kind of to represent the swirl, if you will, of clouds. And that's kind of how I view the relationship between the government, the private sector, and the nonprofit sector. The government frequently sets the vision, the policy, the direction, but of course it's the private sector that brings the capital, the innovation, the skill set, the capabilities, et cetera, to be able to execute. Partnering with that, of course, are the nonprofits who may be supporting the surrounding society. Public-private collaboration is not just about contracts or compliance, but it's also about figuring out what's your shared purpose. That's when real transformation can and does actually happen.
In life insurance, there's a concept, lifetime value, where bringing a new insured in costs a lot more money than the amount of premium. And so when you talk to commercial carriers, it's a similar kind of thing. You need to bring them into the concept that they're going to be with us 20 years, and after 5 years, you can ride through that. But it's a concept that isn't easy for commercial businesses to understand. That's a partnership too. Very, very similar. What advice would you give to somebody aspiring to become a leader in government?
There are 3 things, right? So firstly, around leadership in government, you want to make sure that you're leading with purpose. You want to stay grounded in your values, and don't underestimate the power of relationships. Remember why you entered public service in the first place, and that'll help carry you through some of the inevitable challenges that you're going to face. Making sure that you are also investing in relationships. In government, you rarely have full control, and I think this is, in my view, more important in government than perhaps in the private sector. You are frequently leading through influence. You are collaborating with very different parties who frequently have very different agendas than you do. And so building that trust, investing in building that trust and planting those seeds earlier and along the way in your career, I think is absolutely critical. And certainly last but not least, I would say, don't feel that you have to have it all figured out on day one. Absolutely stay open to the unexpected. Say yes to the opportunities that stretch you, and know that you can lead from wherever you are. It's not just about position or hierarchy. It's about the impact that you can have.
What wonderful advice, especially in today's world, which is a little topsy-turvy. Who is one person, someone you know personally or perhaps someone well-known, that's impacted your leadership style?
The leaders that particularly stand out for me are Colin Powell, a woman named Carla Harris, who was a managing director in investment banking, and then last but not least would be my father. Starting with perhaps the more famous one, Colin Powell. I read his biography, loved his perspectives and the rules of leadership that have been particularly influential for me, right? So get mad, then get over it. Share the credit. Perpetual optimism, a force multiplier, things of that nature. And hearing his story was certainly very inspirational for me. And so I certainly very much look up to him and as a role model. The second person that I mentioned is a woman named Carla Harris. She's an African-American woman, became a managing director at an investment bank in the 80s, at a time when there were not that many women of color in investment banking in New York. And so she's published a book called Her Pearls of Wisdom. That's one of her trademarks. She always wore a pearl necklace, and she has Pearls of Wisdom around how can you be authentic and build relationships to be successful in super challenging environments. And she had a lot of guidance on the importance of finding sponsors and mentors. And certainly last but not least, my father is really my why for I do a lot of the work that I do in the public sector. He started out life like many other, immigrant kids in poverty, he was a strawberry farm laborer. Japanese Americans at the time were not allowed to own the land, so we worked the land. He grew up in that kind of environment. And I just think it's absolutely neat that someone who came really he was dirt poor, to say it, and his daughter ended up working in the White House twice. It's quite the American dream, and I would very much like to have that opportunity available for other people as well.
Well, wonderful, absolutely wonderful. Christine, thank you very much for your time today and all of these learnings. It's really good, impactful. Thank you for sharing.
Oh, thank you so much for having me. I really enjoyed it.
I'm Shane Canfield, CEO of WEPA. Until next time on Lessons in Leadership.
Find the full podcast and future episodes of Lessons in Leadership on the Federal News Network app and anywhere you enjoy your podcasts.